Good afternoon, Virgin Islanders at home and abroad. Hope you are having a fantastic day. Today I'm joined by Commissioner Justa Encarnacion of the Department of Health, as well as our epidemiologist, Dr. Esther Ellis. Right now in the Virgin Islands, we are currently tracking 7 active cases of COVID in the territory. So far, we've tested 872 individuals for COVID-19. 732 of those tests came back negative, 62 came back positive, and we have 4 fatalities. As of this morning, we have 78 tests pending. Those tests pending are indication of our tracing that is being done to ensure that we keep everybody safe. There are 3 COVID-19 patients hospitalized at the 1F Louis Hospital, and none of them are on ventilators. There are no COVID patients at this time at Snyder Regional Medical Center, and they have no PUIs. I want to urge the public to pay less attention in the future to the total number of cases at this time. We had 62 positive cases in the territory over the last several weeks, months. But remember, we have to focus on the active 7 cases that we have in the territory. Those are the ones that we really need to pay attention to. And the 3 people who we have hospitalized, those are the ones, as we move forward, the indicators that we will be looking forward to see if we have increases in them, as they are signaling the stress on our healthcare system and our ability to react to any differentiation or more cases. If you are experiencing symptoms of fever, shortness of breath, dry cough, or fatigue, especially if you have recently traveled or come into contact with someone who may be exposed to the COVID virus, please call the Department of Health hotline numbers. Those numbers are 712-6299 or 776-1519. 712-6299, 776-1519, and the Department of Health will send somebody out there to you to get some tests going. The CDC has also updated the symptoms of which we shared with you previously too. So blue toes, aches and pains. If you have any doubt at all in your mind, don't hesitate. We have enough tests to test you. Please call the number and let us know this. It's not a stigma. We want to make sure that you take every opportunity to call into the Department of Health and let us give you that test. And those tests are available in the St. Thomas and St. John district. If you can't come to us, we certainly will come to you. We continue our battle against the economic downturn, and as we process unemployment applications as quickly as possible. We are happy to report that we're making good progress in this regard. And yesterday alone, we sent out 164 new checks, bringing us to 2,000 checks that we have cut so far, and our total at $1,400,000. As you are aware, the current stay-at-home order expires on April 30th, and our intention is to be reopening our economy. We have created a 5-tier alert system to manage our transition. Those tiers are red, orange, yellow, blue, and green. Red is the most extreme alert, which is triggered by mass community spread and is referred to as total quarantine and requires a variable curfew. So in the red, which we have never gone to before, would be where we would have a curfew imposed. That curfew could be variable. It could be from only in the evenings. It could be 24 hours. But that was when we're really in a bad situation. That is the most extreme. The total quarantine. The next level tier is orange. That's where we are now. It's our current state that we consider ourselves, which is governed by the stay-at-home order. In that stage, we would stay at home as we are doing now. Effective Monday, and I have to say that effective Monday, we will be moving to the yellow alert, which we will be referring to as the safer at home. the safer at home model, which I will explain. And then the other two remaining colors are blue, which is open doors. That's when we start entertaining new visitors coming to the territories, the hotels, guest houses, Airbnb, restaurants, everything open for sit-down dining. And then green alert is our new normal, when we have no real COVID threat, but we are always vigilant, looking out to make sure that we're guarding against COVID or any other disease that may be coming from a new pandemic. The safer at home order that we are executing today, that is becoming effective on Monday, the 4th, relaxes some of the restrictions on non-essential businesses. The order also extends the stay-at-home order in place now until Monday morning at 6 a.m. To be clear, the current stay-at-home order that is in place will not expire on Thursday evening at 12. It will be extended throughout the weekend. On Monday morning, we will have the new safer at home order in place. The most significant change in our status requires that all individuals that patronize commercial establishments to wear a facial covering before they enter the premises. No mask, no service. I want to repeat that. The most significant change requires that if you're going to go to a business, a place of business, you are required to wear a mask to get in. All of the people that work there are also required to wear a mask. Furthermore, any gatherings of people require a facial covering, not necessarily a mask, an N95 or an N95, or just a facial covering that covers your mouth and your nose, that protects the other person from you infecting them and lowers the chance that you will be infected by another individual. This rule is for everyone except children under the age of 2 and people with acute respiratory issues. So if you have problems breathing already and you can't breathe through a mask, you are an exception to the rule. I'm asking that we all be mature and look out for the best interests of ourselves, our loved ones, and our community on a whole. Recreational facilities such as gyms, tennis courts, and golf courses are allowed to reopen as long as physical distancing and group limits are able to be achieved. So you can be somewhere like a gym, but you still have to keep your 6 foot from people that are not in your group. So if you and your family work out together, that's your group. You're always with them. You sleep in the same house. There's no threat there of further contaminating because you're already together. But if from other people, you must be able to remain that 6 feet. Contact sports such as basketball, volleyball, football are strictly prohibited. You're bumping around, you got 5 on 5 or whatever. We don't want people sweating, touching one another. That's strictly prohibited. All the equipment you're using for these activities must be properly sanitized and not shared. Bowling alleys and movie theaters are allowed to open, but however, there will be no selling of food or beverages or drinking of beverages or eating on the premises. If you can't abide by those rules, then those establishments will have to remain closed. Private offices are currently closed and allowed to reopen, but they should encourage all employees that are not critical to in-person operations or classified as essential should be allowed to continue working from home or remotely. So the way it is now, if you don't have to go to the office, if you're an employer and you don't need to have that person in the office, let them continue to work remotely. Government operations, we will remain in a current hold pattern with non-essential employees remaining at home and as many essential people as possible working from home. All conditions laid out for public interaction with government offices remains the same until further notification. So all the people who are non-essential, essential working, and essential at home, all of that stays in place. All the operations that we have put in place for you to interact as a private citizens with government offices, those will remain. Private healthcare facilities are allowed to resume procedures if the facilities are allowing, if the facilities are following accepted protocol. Personal grooming services such as barbershops, hair salons, massage therapists are permitted to operate by appointment only. They must employ strict hygiene guidelines and frequent sanitation procedure for all their contact services in the shop and the tools. These include hand sanitizers for all patrons upon entrance into those establishments and masks in place for the entire time of the visit where permissible. So if you are getting your nails done, you need to have your mask on in that establishment all the time. If you're getting your hair cut where permissible, you can take off the mask to groom certain parts, wash your hair or whatever, but as soon as possible, putting that mask back in place. All beauticians, barbers have to have, estheticians have to have, the manicurists have to have those masks in place 24/7. No more than 5 customers will be allowed into any establishment at any given time to wait. And no more than 10 people, including the people that work there, can be in the establishment at any time. If you have a larger establishment, you can check with our Department of License and Consumer Affairs to make sure that you have the 6-foot spacing guidelines that are required for safe operation during this pandemic period. Furthermore, the Department of Health will be providing more specific guidelines for the operations of these personal grooming operations to make sure that we're keeping safe. Retail stores. No one will be allowed, retail store will not be allowed to have more than 10 individuals in the establishment at any given time. The only exemptions to these are the grocery stores and the big box stores. So if you have a normal retail store, you're not allowed to have more than 10 customers. I'll take an example of what used to be probably Kinney Shoe Store, so I don't call out any brand. A normal shoe store that you would go to buy sneakers or athletic shoes, only 10 patrons roaming the floor at one time. That is what we're going to adhere to, so that gives the public a sense of what we're dealing with. Remember, no mask, no service. No businesses are allowed to give service, indoor service without a mask, or outdoor service without a mask. Visitations to our nursing homes are still prohibited. Child care facilities are still closed. Our schools will remain closed, and the Department of Human Services will be giving more guidelines about how and when those are to be opened. All the schools, those include public, private, and parochial, will continue to be closed. Restaurants are limited to takeout only, delivery, or drive-through. I want to make sure that when we went through this, what we used as a model for this is we looked at different cases of how the virus is being transmitted, and we found that prolonged periods of stagnation in an area next to an infected person is what causes this. So we don't want people eating food without a mask, because that's what you would have to do, being exposed to virus, sitting down in places eating for any extended period of time. Bars remain closed throughout the territory. We're making sure we do this because bars, not only do they serve alcohol, which lowers your inhibitions and makes people congregate, but it also requires you to take off your mask in order to partake in drinking. So All the bars are going to be remaining closed. Restaurants with takeouts are free to serve takeout drinks until we move from this stage. We're going to take a leap of faith and say that churches are allowed to conduct service providing that they do not exceed a capacity of 50. Every single person, including the pastor, priest, rabbi, imam, has to wear a mask during the service, a facial covering. Not necessarily a surgical mask, but a facial covering that stops the spray of any fluids or atomization of fluids out of your nose and your mouth. We encourage churches to continue their virtual services to the greatest extent possible. We know that our seniors like to go to church, and they are part of our most vulnerable group, and we want to keep them safe. Generally, we continue to strictly enforce the social distancing mandate of 6 feet of separation between customers when not directly conducting service. So if you're waiting in a line, that's what you need to do. The other thing about churches, I don't think I have to say it, but I'll say it anyway: no communion, no distribution of wine. Those things just lead to the spread of the virus. Employers, you should encourage your frequent breaks, whether you're in a restaurant or not, of your employees, and require that they wash their hands. And they should also require that when your employees are sick or even showing any signs of symptoms, that they remain at home. They should require facial coverings or a mask during customer interactions and whenever possible during work activities. Again, we encourage all employees not critical to operations to continue working from home. We anticipate moving from this yellow safer at home status to the blue open door status on June 1st. That's when we'll be opening up the reservation systems and welcoming tourists back, leisure travelers into our territory. We figured this month we'll be able to see where our weak points are, reinforce our airports, which we have found to be where the virus is coming into the territory, at the same time being able to get more reinforcement at both hospitals. The build-out of the temporary acute care center at the regional training center at the National Guard will be finished, and we'll continue to get more resources there. I also want to say the same principle for loitering still applies across the board. We do not want to see you at gas stations, hanging out, drinking beer, or otherwise socializing. Get your stuff and go. We are not out of the clear by any means. This is just one step. We are encouraging all our vulnerable residents, our community, to stay at home to the greatest extent possible. You are safer at home. For the purpose of this executive order, vulnerable individuals are individuals who are 65 years or older, individuals with chronic lung disease or severe asthma, individuals with serious heart conditions, and individuals who are immunocompromised and pregnant women. Please, if you can, stay at home. You're safer at home. But I want to remind the public that as we have loosened some of these restrictions, you too are safer at home. Not just the vulnerable individuals, you too. We have been very successful in securing the commitment of $60 million line of credit to help with our government operation. We have also been very successful in securing $75 million in the CARES Act, which is deposited in our accounts. We have applied a $250 credit to every residential home account and $500 credit to every single commercial account, even yours. We have had an agreement made between us and Treasury to get the $84.7 million in advance payments on your stimulus checks. The U.S. Treasury has every single thing from us that is required as of April 2nd, 2020. all U.S. territories are in the same situation. Neither Puerto Rico nor any U.S. territory, Guam, Northern Mariana, American Samoa, have received either the regulations or the funds in order to pay the stimulus checks. Our check roll is ready to go. It's all lined up. We know who has to be paid, and we're ready to pay it. We are just waiting for Treasury to give us the green light. And as soon as we get that check, you will get your check. Rest assured, we want to make sure this money is out in our community just as bad as you want to deposit it in your account. From our actions, you have seen that we've done every single thing to ease the pressure on our community, to assure that your light bills are paid, to assure that you would not be disconnected from service, and to assure that as we ride out this thing together, you can bet your confidence in the Bryan Roach administration and the team of professionals that we have amassed in order to bring this Virgin Islands to a better place. So I thank you for your patience. I know you're anxious to get this done, but as soon as we get it, you will get it. I'm also joined today, as I said, by the Health Commissioner, Justa Encarnacion, that wants to share a little message for our healthcare workers. Commissioner?
Good afternoon. Thank you, Governor. I like the stay at home or stay safer at home. With that, I want everyone to pause. I know it's easy to say, okay, we can get out and we can charge forth, but I just want you to pause and think about the things that the governor just said. Do the things you have to do outside, but besides that, please stay safer at home. In reference to the guidelines that we will be submitting, we're working closely with the Department of Licensing and Consumers Affairs to provide those guidelines to you, and we'll make sure that we give them to you both in English and in Spanish, and Creole if needed. A message to the healthcare workers, though. We want to say to you, thank you, and these are the healthcare workers throughout the territory. We know that we do have some positive healthcare workers, and to them, I wanted to say that we appreciate what you've done. You are valued. Thank you for risking for us. I know that no matter what you do in terms of healthcare workers throughout the community, throughout the nation, actually has been diagnosed with COVID ever so often, sporadically, but you've heard that within the news. And so the VI is no exception. We have now had some positive within our healthcare community. And with that, we want to say that if there's anything that we can do to continue to support you, to ensure that you have adequate PPEs, we will continue to do that. It's something that it's no fault to anyone, and I want to make sure that the entire community realizes that. We are enforcing and reinforcing, I should say, our infection control practices, because I think practice actually leads to more of a perfect working environment. We're looking at also behavioral health. What is it that we can do to create a more comfortable thought process for the people that are working with individuals who are highly suspect or positive? It brings another layer of sometimes anxiety. So we're working with our team to provide not just some comfort in reference of personal protective equipment, but just being able to communicate with us and see if there's anything that we need to do to help you more. And then the governor spoke of us working with certain groups to bring you more staffing. So we had several meetings thus far with the Islamic Medical Association and other groups. Today we meet with Department of Health and Human Services Region 2, and we'll have that discussion again. So we just want you to know that we're there with you, and we really value what you've done. And just like how we ask everyone to call the numbers, if you too feel like you have symptoms of the community, again, we ask that if anyone that you know of, encourage them to call the numbers that we just spoke, the governor spoke of, 776-1519 and 712-6299. Thank you much, everybody. Stay safe, and remember your health, the public's health, is of utmost importance to us. Thank you.
Thank you. We have a number of questions from the press. We can open up the phone lines now so we can have those. Go ahead.
Good afternoon, Governor. This is Sarah Burke with TV2.
Hi, Sarah.
How are you, Governor? I wanted to find out, Governor, in the process of issuing and getting prepared for the stimulus check, at this junction, does IRB have all applicants for system for 2018 to include those individuals that were deemed receiving Social Security benefits so that issuance of checks can go out to them as well?
No, I'm glad you asked that. One of the things that I forgot to mention is that we still have not received adequate guidance on whether or not Social Security is going to be issued to directly, or we're going to have those people come in and file. We keep asking them for the guidance. We haven't. However, I am aware of one individual who has gotten a stimulus check from Social Security, and that person is in the Virgin Islands. That person filed in the Virgin Islands, but now lives on the mainland. So they got a check deposited into their account. So they may be doing things that we don't know about, but as of this moment, we don't know. As far as the 2018, people are filing 2018 tax returns every single day. So we don't know, so we can say, no, we haven't had everybody for 2018 in there. However, we can say that the substantial balance of taxpayers have already been entered. We've calculated what their checks would be based on how many children they have, and those check rolls are ready to go. The people who are putting in tax returns now, we'll be able to process those as well. They will not get their checks as quickly, but we have until December to issue the total of $84.7 million. So your money isn't going away. Certainly we'll be expediting and using every resource to get those checks out quicker to people than December. We want to make sure that we get everybody paid within the next 4 to 6 weeks here.
That's great. There was a point of confusion, though, however, between our delegate to Congress, Stacey Plaskett, and what she was saying versus what you have made mention in terms of the readily available funds. Now, what I wanted to get a clear understanding is, compensations that are needed for us to go forward in terms of these funds being able to be released, or because we are ready, those funds should be forthcoming, like, as you just indicated, anywhere between 4 weeks. Where are we? I mean, has everything been submitted to Washington so that we can get reimbursed? Because I'm aware that the way that these funds were set up is on a reimbursement rate. Do we have enough in our Treasury to meet those demands, Governor?
We were able to get Treasury to agree to pay the checks directly so that we don't have to be reimbursed. So they're going to give us the money directly so we could just cut those checks and let them go. There is everything that Treasury needs from us is sent there already. The last correspondence from them we got, they said that no one's plan has been approved as yet. That's Puerto Rico, Northern Samoa, Northern Marianas, American Samoa, and Guam. None of us plans have been approved. We were simply reaching out to the delegate to ask her assistance, helping us expedite that. We think that we should be paid on the same scheme timelines as every American is. And why aren't any other territories paid? Why hasn't the Commonwealth of Puerto Rico been given their money yet? We know that Treasury has a lot going on because they also sent us the CARES Act money, the $75 million that we have, for which we're doing the YES program with, our farming program, transportation program with. So it's a little bit more complicated around the tax. Puerto Rico doesn't have a mirror tax system. We do. So they got to make sure that the way that they're distributing these money has the correct rules around them. We're clear on whether we're issuing checks to Social Security recipients or not. Just as an example, you may be getting Social Security, but it may not be accounting for, on a tax return, you may have other income through your husband, or you may be the guardian of a child. All of that has to be taken account. So we're just waiting for the rules, and once they have the rules, then the money will follow.
Thank you so much, Governor, for answering my question. Have a great day.
Thank you.
And happy Carnival.
Happy Carnival. Oh, Lord. Still getting over that one. Next question.
Good afternoon, Governor. Robert Moore at the VI Consortium.
Hi, Robert.
Hi. Good afternoon, sir. So there's obviously a pretty significant list of guidelines or guidances for those businesses that can open with the loosening of restrictions on public activities. What can those businesses expect in terms of enforcement? How will the government or the territory enforce the guidance on facial coverings for both employees and customers as well? What can be anticipated in that respect?
Well, what we have done is we've asked, first of all, I know people are always about, well, how do you enforce it? Well, the people enforce it. I mean, do you feel comfortable going into a hairdresser or a barber or a salon where people don't have masks on, where they've used clippers on somebody else that are not properly sanitized? Do you feel safe going into places where people don't have masks and they're preparing open food? So that's the first step. The other thing that we've done is we've asked Commissioner Vellenor to advise the police officers now to stop in and periodically check in on some of these businesses to make sure that we have compliance. And we're asking you, the public, to report businesses that are not in compliance. I get reports all the time of compliance. We had a business the other day that checks people's receipts at the door. I had a call in, and that is not safe because the person didn't have on gloves, the person who's giving them the receipt didn't have on gloves, and then even if they have on gloves, they're contaminating the next person's receipt. So they could swiftly discontinue that practice as soon as we call them. So I'm not going to sit here and tell you we're going to have 100% compliance and we're going to be able to make sure that every single business uses that. But if we catch you, you might, like my mom used to say, sheep luck and goat luck ain't the same. If we catch you, we're going to shut you down. And we're going to shut you down for a significant amount of time that makes it pay. Because the customer is not who we're going to get at. It's the business owner and the employers. It's your business license that we're going to revoke.
Sure. Governor, my other question is related to the energy subsidy program, the $250 subsidy on electric bills for residential customers, $500 for commercial customers. Is there does the territory need any additional approvals from the Treasury Department or the federal government? Does it need to submit any additional documents for that program to move forward?
No.
Or is there any other guidance that we're waiting for?
No, we already cut the check, and that program is already in effect. What we did was we didn't have the guidance from Treasury on how the money was being spent. The money was deposited, and we just kind of got a little bit of guidance, and I guess other states started complaining that they wanted a little clarity, so they issued the guidance. And it essentially says that if you use it, once you're using this money to offset any expenses to people who are affected by the economic downturn because of the coronavirus, that is applicable. We sent Treasury a letter before we got the guidance telling them what we were going to do with the money, but once we got the guidance, we were assured that we were in compliance with any federal mandate.
Very good. Thank you very much, Governor.
Thank you. Next question.
Hello, good afternoon, Governor. Hi, this is Lasiba Knight over at the St. Cravis.
Hi, Lasiba.
I have two questions, one for you and one for Mrs. Encarnacion. And this is for you, sir. What is the mask situation in the territory? If you need a mask to leave your home and conduct business, is there adequate supply in the territory to support this demand? I know you said like a cloth face covering.
Right.
But these things are they've been in short supply everywhere, and I imagine here as well. I know I can't find any.
So
and then my question for the committee.
Let me answer first, so she remembers what you asked. So that's why we made an effort to say facial covering, because there are a lot of different ways you can make masks. There's masks on sale everywhere, and if you notice, we didn't really give a outside mandatory mask order. For that reason, we understand that everybody's pocketing the same and everybody doesn't have the ability to purchase masks. But there are a lot of different, you can use a handkerchief, just tie over your face in order to go into the store. And as we move along, I'm sure that more and more stores are going to make those masks readily available because they want to have customers as well too. So we're doing things to work with people. I have personally commissioned the Property Procurement Department to order substantial amounts so that we can help people with this situation and get adjusted. I will be wearing my mask. I've heard all of you complaining out there about they see me exercising without my mask. I'm going to exercise without my mask, but I'm going to be wearing my mask and setting a good example of social distancing and how to wear your protective equipment. Right, Commissioner?
Thank you.
But you just as long as you have a facial covering, you're good to go. And so Lasiba, I totally understand what your concern is. It's one of ours as well too, because people have enough expenses now to have to go out and buy a mask is an additional expense we don't want to incur on people. Your second question?
Thank you, Governor. And Commissioner, how effective would you say our contact tracing has been in the territory? It seems as though a lot of the new cases are a result of community spread. And could you describe perhaps a recent contact trace investigation and how that was conducted? So people have a really good idea.
Good afternoon. Thank you for that question. Before I actually go to that question, I want to enforce also not just that we're asking you to have facial coverings, but it's important to continue good hand washing techniques, as well as have your hand sanitizer available if you do not have access to water and soap. That's principle, that's primary, so please continue to do that. In reference to the contact tracing, that's why you see the large number of pending cases, but I'll actually refer that question over to Dr. Esther Ellis, since she's here with us today.
Good afternoon. Yeah, that's if you look at the EPI report that we put out last night, you can find it on the Facebook page for U.S. Virgin Islands Department of Health Facebook page. They're posted daily. There's 78 pending tests, and that's a result of very robust contact tracing that we're doing. And the contact tracing was, you see that dramatic increase in additional pending tests because we contact trace each positive that we get. The one thing that I would like to say about the positives that you mentioned that we've been getting lately, they have all been contacts of confirmed cases. That is the best case scenario, and that means that our contact tracing is effective. Community acquired cases or cases where somebody tests positive and we don't know where they got it from. We have not had a community-acquired case in the U.S. Virgin Islands since April 13th. That's wonderful. And so I just do want to just take the opportunity to thank the EPI team. They've been working really hard to do that contact tracing to keep everybody safe. Every single one of those pending tests is considered a person under investigation, and they are quarantined until COVID-19 is ruled out. Once if tested positive, then those individuals are quarantined until it's safe for them to return back out to the community. Thank you.
I think that's important. Thank you, Dr. Ellis. I think that's important for people to know that when we contemplated doing this easing of the doors a little bit more, peeking out into what our new reality would be, what we decided was that we're going to get more cases. It is evident that we're going to get more cases, but it's not getting the cases that's the problem. It's putting in the work in the contact tracing so that we can quickly find out who a PUI or a confirmed case has been in contact with, and get those people tested quickly. And we have the resources to do that right now. That is why we're going toward this. But the one thing that we want to make sure is that as people continue to come in our community, that we stay safe. You don't know where people are coming from. You don't know if they just came back from New York or Washington, D.C. or wherever, and you're coming into contact with them in person. At the very least, they should have on a mask. You should have on a mask. They should be quarantined for 14 days when they arrive here. These are the minimal things that we want to do to make sure that we don't have that spread. I know you want to get back to your life. I certainly want to get back to mine. So the only way we can do that safely is to wear your mask. If you're going to congregate or meet people, our suggestion is that you always wear your mask. If you're going into a place of business, you have to wear a mask. If you're having a gathering, meeting, party, you have to put on a mask or a facial covering. This is what we need to do to keep you safe. Next question.
Good afternoon. This is AJ Rao with the Daily News.
Hey AJ, how you doing?
I'm doing well, sir. Just one quick question. Regarding this 5-tier alert system, I was wondering what must be achieved in order for us to move from one phase to the next? In other words, are there specific benchmarks that you're hoping to reach before we can move to the blue phase and then to the green phase? And finally, do you anticipate the yellow phase coming up? Do you anticipate that lasting through the summer?
Yeah, I really don't see us going back to any social gathering more than 250 people before we find a vaccination for this thing, or it completely dies out, as some hope it will. That's best case scenario. So the things that we're looking for the red phase is when we have massive community spread. This phase that we're in now was actually a control. This is the orange that we're in now, was a control phase where we had a limited quarantine, essential and non-essential workers riding. This is the most dire we ever want to get again. What triggered that is when we were seeing significant community spread. Where we're going back now is like we're only seeing travelers and contacts, so we just reinforce our testing and make sure that we have adequate tracing going on so that we can quickly identify people. And then the blue phase, we just have to remain vigilant as we will be seeing more and more travelers come in. We want to do that slowly. Around the 15th of the month, we may start to let in charter business customers. Those customers would have to be tested before they come to the territory for charter vessels that are going out into and around the islands. They won't be for people staying on island. And that will give us a little intro into the tourism market. By the end of the month, we should have all the camera, the infrared, temperature testing cameras at the airports and at the seaports in place. So it's a little bit easier to monitor the traffic in. We're working with the airlines now who are requiring masks, most of them now, for people who are coming into the territory. And we're also working with the cruise lines to manage that, but we don't anticipate that coming back for at least until late July. So that's kind of like how we're going to move up and down between this, and this is our, I still like to call it is our proposal, but it's a living one. So we might find out what another system works better. We may find out there's no threat in opening restaurants in our yellow phase, but we got to give it a little time to work. So we figure we live in life now on 14-day cycles, at least until the 15th of the month, see how we're doing, and then we give it till the 30th, and then we see about tourists. During that time, we will definitely have a period where we have an increased number of active COVIDs in the territory, and depending on how we respond to that, then we will keep to that date, June 1, or move that out if we have to, because my priority and the priority of the entire team here, the Lieutenant Governor, and everyone is to keep people safe. That's the first priority. Yes, our economy is hurting, but we can make more money. We can't bring anybody back. Next question.
Yes, Governor Ernest Gouveia Consortium.
Hey, Ernest.
A few questions. The first one would be for, hey, Gov. The first one would be for the Commissioner of Health. Of course, we've listened to the Governor lead forth the plan there to reopen the economy and the territory, and being that the yellow phase opens on Monday. What we've heard from the CDC, from health officials, is that mass testing is what is going to be needed in order to get a good understanding of where we are and to safely reopen, whether it's our territory or state. And so looking at the numbers, we have seen that there's been an uptick in the amount of tests being performed. Nonetheless, the mass testing that we need hasn't taken hold. Can you give us an idea as to when the Territorial residents could expect much more testing than what we're seeing now?
Okay, I'm going to answer part of that question, and then, of course, Dr. Ellis, having a little bit more information about the laboratories, will be able to answer the second portion of that question. But just to let you know, we're working on memorandum of agreement with two entities, one in St. Croix and one in St. Thomas, to use their establishment as an area where we conduct mass testing. So we're well into that phase. We're looking at acquiring equipment and supplies for the hologic machine that Dr. Brett Ellis has spoken to the community about in the past. And we're hoping to secure that within the next week or two. And so we should be able to conduct our mass testing on that. But just to let you know, we have not refused. We have not had to turn anyone back that has had symptoms. So we're testing everyone that has symptoms at this point in time. But in reference to the details, I'll have Dr. Ellis speak a little bit more about the details in terms of the lab.
Yeah, thank you. And if you didn't get the numbers earlier, if you need to get tested and you have symptoms, we're testing anyone with symptoms. It doesn't matter if you've traveled or if you're a healthcare worker, anyone at all. It's 100% free. That's 340-712-6299 or 340-776-1519. And the CDC and other health officials also say that if your positivity rate is 10% or lower, you're doing enough testing. So right now our positivity rate is 7%. That means only 7% of everyone we test actually tests positive. That's really great. That shows that we're casting the net wide. We're catching mostly negatives, and then the positives that we're catching are quarantined and safely protecting themselves away from others so others aren't getting it. As far as mass laboratory testing, we are on track by within the next week to be able to test up to 1,000 samples a day. And that's by the PCR test. That's the same test that detects the actual presence of the virus. So thank you.
Ernest, you still there? We lost him again. You have other questions? No more questions. I'd just like everybody to, continue to be vigilant out there. Remember, safer at home starts on Monday. Stay at home is extended through the weekend. We just want to make sure we give you a chance to go out and get you a mask if that's what you want to do, create a facial covering. So you're good until Monday. However, we do recommend you're interacting out there in the public, that you do use a facial covering to keep yourself and your family safe. We will continue to be vigilant. You continue to be safe and sanitized. God bless you. God bless the Virgin Islands. Have a good day. And remember, the Spanish version of the press conference will be on as soon as we depart. Take care.
COVID-19. Hasta ahora en el territorio hemos probado 872 individuos para COVID-19. 732 de esas pruebas dieron negativo, 62 positivos y hemos tenido 4 víctimas mortales. A partir de esta mañana tenemos 78 pruebas pendientes. Hay 3 pacientes con COVID-19 hospitalizados en el Hospital Juan Francisco Luis. Ninguno de estos pacientes está en ventiladores. No hay pacientes de COVID en el Centro Médico Regional Roy Lester Schneider. Quiero instar al público a que preste menos atención al número total de casos y más atención a los casos activos actuales. Hemos tenido 62 casos positivos en el territorio, pero solo tenemos 7 casos activos, de los cuales 3 están en el hospital y ninguno de ellos está ventilado. En el futuro veremos un aumento de casos, pero lo que debemos gestionar es el número de casos que se encuentran en nuestro sistema de salud. Si usted tiene síntomas de fiebre, dificultad al respirar, tos seca o fatiga, especialmente si ha viajado recientemente al territorio o ha estado alrededor de alguien que puede tener el virus, por favor llame a los números de la línea directa del Departamento de Salud. Esos números son 340-712-6299 para los residentes de Santa Cruz y 340-776-1519 para los residentes en el distrito de San Tomás, St. John. Seguimos procesando solicitudes y cheques lo más rápido posible. Estamos haciendo un buen progreso con la ayuda adicional recibida. Ayer procesamos 164 cheques, que nos lleva a un total de 2.012 cheques y un total de $1.4 millones en total. Como usted sabe, la orden actual de quédate en casa expira el 30 de abril. Nuestra intención es comenzar a reabrir la economía local en preparación para eventualmente devolverles el acceso al mundo exterior. Los gobernadores en la nación están lidiando con la manera en que reabrimos los negocios. Aquí, en las Islas Vírgenes, daremos un equilibrado paso hacia adelante. Es nuestra primera vista desde la puerta a la nueva normalidad. Para gestionar nuestra transición, hemos creado un sistema de alerta de 5 niveles. Los niveles son el rojo, el anaranjado, el amarillo, el azul y el verde. El rojo es la alerta más extrema que se activa con la propagación comunitaria en masa y se conoce como cuarentena total y requiere un toque de queda variable. El anaranjado es el estado actual en que nos consideramos estar, que se rige por la actual orden de quédate en casa. A partir del lunes pasaremos a la alerta amarilla, que se denominará más seguro en casa. Los otros 2 colores restantes son el azul, al que nos referimos como la puerta abierta, donde permitiremos que los hoteles y casas de huéspedes reanuden las reservaciones de huéspedes de placer y los restaurantes estarán abiertos para sentarse. La alerta verde representa lo que será nuestra nueva norma de vigilancia sostenida. La orden más segura en casa que estamos ejecutando hoy se hace efectivo el lunes 4 de mayo. Está relajada algunas de las restricciones a los negocios no esenciales. La orden también extiende el mandato de quédate en casa hasta el lunes en la mañana a las 6 a.m. Para ser claros, la orden actual de quédate en casa permanece vigente hasta el lunes. El cambio más significativo en nuestro estatus requiere que todas las personas que patrocinen establecimientos comerciales lleven una máscara antes de entrar. No hay máscaras, no hay servicio. Además, se requiere una máscara a toda persona reunida. La única excepción a las normas son los niños menores de 2 años o cualquier persona con problema respiratorio agudo. Pido que todos seamos maduros y busquemos el mejor interés de nosotros mismos y de nuestros seres queridos. Las instalaciones recreativas como gimnasios, pista de tenis o campos de golf pueden reabrir si se produce un distanciamiento físico y límites en los grupos. Está estrictamente prohibido practicar deportes de contacto como lo es el baloncesto, el voleibol y el fútbol. El equipo debe estar desinfectado correctamente y no compartirse. Las boleras y los teatros pueden reabrirse, pero tienen prohibido vender comida y bebidas o organizar fiestas. Las oficinas privadas actualmente cerradas pueden reabrirse, pero deben alentar a todos los empleados que no son críticos para las operaciones en persona o clasificados como esenciales a seguir trabajando desde casa o de forma remota. Las operaciones gubernamentales permanecerán en su actual patrón de retención con los empleados no esenciales permaneciendo en casa y con el mayor número posible de personas esenciales que trabajen desde casa. Todas las condiciones establecidas para la interacción pública permanecerán vigentes hasta que se notifique lo contrario. Los centros privados de cuidado de salud pueden reanudar los servicios si las instalaciones siguen los requeridos protocolos de seguridad. Los servicios personales, como las peluquerías, masajistas, pueden operar solo con cita previa. Deben emplear estrictas pautas de higiene y procedimientos de sanidad frecuentes para todos los servicios y herramientas de contacto. Esto incluye desinfectante de manos para todos los clientes que ingresen a la tienda y máscaras en su lugar durante todo el tiempo desde la visita donde sea posible. No se permitirá que más de 5 clientes esperen en un momento dado y no se permitirá la entrada de más de 10 personas en cualquier momento, incluyendo a los empleados. El Departamento de Salud proporcionará directrices adicionales para este tipo de servicio. No se permitirá en ningún momento la entrada a más de 10 personas en un establecimiento. Las únicas exenciones a este requisito son las tiendas de comestibles y las grandes tiendas previamente exentas. Las visitas a residencias de ancianos todavía están prohibidas. Las instalaciones de cuidado infantil siguen cerradas, sujetas a la orientación proporcionadas por el Departamento de Servicios Humanos. Todas las escuelas públicas, privadas y parroquiales permanecen cerradas. Los restaurantes siguen estando restringidos a solo sacar, entregar o autoservicio. Los bares permanecen cerrados. Las iglesias pueden llevar a cabo el servicio siempre que no se excedan a una capacidad de 50 personas y que todos, incluyendo el pastor, lleven una máscara. Animamos a las iglesias a continuar los servicios virtuales en la mayor medida posible. Generalmente, seguimos aplicando estrictamente el mandato de distanciamiento social de 6 pies de separación entre los clientes cuando realizamos directamente el servicio. Los empleadores deben alentar periodos de descanso frecuentes para facilitar el lavado de las manos. También deben exigir a los empleados que se queden en casa cuando muestren cualquier señal o síntoma de enfermedad. Deben requerir máscaras o mascarillas durante interacciones con los clientes y siempre y cuando sea posible durante las actividades de trabajo. Una vez más, animamos a todos los empleados que no son críticos para las operaciones a seguir trabajando desde casa. Anticipamos pasar de este estado amarillo en casa al estado azul de puerta abierta el 1 de junio. Esa es la fecha vencimiento o tentativa marcada para la reapertura de las Islas Vírgenes a los viajeros de placer. Estamos alentando a las personas vulnerables a permanecer en casa en la mayor medida posible. Estás más seguro en casa. A los efectos de esta orden ejecutiva, las personas vulnerables son individuos que tienen 65 años o más, individuos con enfermedades pulmonares crónicas o asma grave, individuos con enfermedades cardíacas graves, individuos que son inmunocomprometidos y las mujeres embarazadas. Pero quiero recordarle al público en general que como hemos aflojado algunas de las restricciones, usted también está más seguro en casa. Hemos tenido éxito en asegurar el compromiso de una línea de crédito de 60 millones para ayudar con nuestras operaciones gubernamentales. También hemos asegurado 75 millones como parte de la ley CARES. Adicionalmente, hemos aplicado un crédito de $250 a cada cuenta residencial de WAPA y crédito de $500 a todas las cuentas comerciales. 84.7 millones en pagos anticipados en sus cheques de estímulos también se ha desarrollado. El Tesoro de Estados Unidos, a partir del 2 de abril, tiene todo lo que requiere de nosotros. Todos los territorios de los Estados Unidos están en la misma situación. Puerto Rico y ningún otro territorio americano ha recibido los procedimientos ni los fondos para distribuir fondos de estímulo. Los cheques están listos para salir. Todo lo que estamos esperando es a que el Departamento del Tesoro nos dé la luz verde. Tan pronto como la tengamos, recibirás tu cheque. Gracias y que Dios les bendiga.